Center, which is in one of the major hospitals of the Northwell Health system. We call it V-Day. It's a day when we can hopefully begin to see the beginning of the end of the COVID crisis. And I just want to emphasize to everybody that is watching that while this is an extraordinary time, an extraordinary moment, and we will be rolling out the vaccine over the next number of months, but as we do that, this is no opportunity and no reason for people not to continue to wear masks, not to continue to social distance, and wash hands. So all of the preventive things that the public needs to be doing should continue to do, everybody in the public, because just because we have a vaccine doesn't mean that we can lay off all of the other preventive things that we know we have to be doing to keep people safe. So at this point, I would very much like to ask Dr. Mark Jarrett, who is our Chief Quality Officer for the health system, to come up and say a few words, and then we will proceed from there. Mark.
Thank you, Michael. I want to thank our team members who are willing to get vaccinated today, and all of our team members who will be vaccinated over the next 4 to 6 weeks. As you know, the Pfizer vaccine is now out in production and out. We will see the Moderna vaccine probably in the next several weeks as well. And the first priority for our area, for New York State, is healthcare workers. These have been the heroes on the front lines who are critical, not only for taking care of COVID patients, but taking care of all of us every day for the common things that still happen, heart attacks, strokes, things like that. So they are really critical to maintaining the health of our communities. We were very careful in how we are approaching this with our healthcare workers. We've developed a matrix which looks at not only their age, but things such as where they work, what is their job function, things such as that, so we can roll it out in an organized. This is something important, but again, remember, this is a marathon, not a sprint. We will get the vaccine to all of our healthcare workers, and we will get the vaccine to the general public. It will just take a little time. And I want to reemphasize what Michael had just said. We must keep up everything else we're doing until we've achieved herd immunity with social distancing, mask wearing, as well as obviously washing our hands. So these are critical things. Again, I thank you all for coming to see this today. This is an important step in our really getting out of this morass that we've been in with this virus and really going back to a normal lifestyle, hopefully sometime in 2021. So thank you all. Michael?
And just a few moments ago, we actually vaccinated the first employee, and I will, if this works here, who's got a technology person over here? So the person administering the vaccine was Dr. Michelle Chester, who's right here. And the person who actually received the first vaccine was Sandra Lindsay. And Sandra Lindsay is an ICU worker, works in the ICU here at LIJ, has been on the front lines of COVID. And I would just like to ask Sandra at the moment to come up here and just say a few words, and then the second vaccination.
Thank you, Mr. Dowling. Good morning, everyone. As Mr. Dowling mentioned, I received the vaccine a short while ago. I feel great. It didn't feel any different from receiving my annual influenza vaccine. I am very proud to be a healthcare worker, so very proud to be in this position to promote public confidence in the safety of the vaccine. I encourage everyone to take the vaccine. This is significant should be significant for all of us, as it signifies hope, healing, restoration of public health and public safety, and don't give up on the efforts that we have been engaging in so far in terms of wearing our masks, social distance, believe in the science. I've worked on the front lines for months alongside my colleagues who work tirelessly to put an end to this pandemic. And so this signifies a step in the right direction to end this pandemic. So thank you all.
Thank you, Sandra, and congratulations to you. And now we move to, so you can observe the second vaccination, and it's going to be done by Dr. Michelle Chester. And the person sitting in front of you is Dr. Yves Duroseau. He is actually the head of the emergency medicine at Lenox Hospital. And so now you can observe second vaccination.
Ready?
Yes,
Okay,
please.
let's do this. Okay, here we go. Okay, you are all set.
Thank you very much.
You're welcome.
Feeling great. Feeling great.
You can say a few words. You have talked about how you feel.
It feels great. It feels any different than receiving any other vaccination that I've received in the past. I'm very, very happy for this moment. I'm very thankful for this moment. I want to thank all the frontline workers who have fought through this for so many months, who will continue to fight through this for so many months. This is a very important day. This is a hopeful day. It's very important that when the vaccine comes, that we feel confident in the science that is okay to take. I wanted to be here. I was excited to be here to myself, for my family, for my patients, for the community at large, for the world at large. It's a very important day today, a very hopeful day. We have to continue, however, on this journey to remain safe. Yes. Wash our hands. This is going to be very important, not to gather. If we do all of those things successfully, we will conquer this virus. So I thank you for this opportunity.
Doctor, you've seen so much trauma and so much death over the last 9 months. What was going through your mind when you felt that injection?
Hope. We've been through so much that this was the first step towards hope, towards getting to a place where we do not have to worry about ourselves, about our loved ones, about our families. We've seen a lot of despair, and this is a positive moment. This is a major turn, the most significant turn during this pandemic.
Doctor,
What is your message to people who are still skeptical about the vaccine?
There is science behind the vaccination. There is a lot of science that I've researched, our colleagues have researched, the FDA has researched, New York State has done its independent research on the vaccination. It is safe. I had no fear, no doubt of sitting here and receiving the vaccination.
Doctor, over here, please. You know that a lot of communities of color have been hard hit by COVID, and some were fearful of getting the vaccine. Is it important for you to reassure them that the science is there to get this and to feel good about it?
Absolutely. And for those who have suffered the most, the consequences are the greatest. And the reason to take the vaccination is even more significant. So I encourage you to read the science, to listen to the recommendations of the scientists and the physicians. I recommend it. I am from that background. I am from that community. And I saw a lot of devastation. I saw it personally in my family. So it is very important to not fear the vaccination. It is based on science. And this is what's going to save the lives. We cannot continue to have 3,000 people die a day. This has to stop. And the only way to stop this is through the vaccination.
Can you talk about your own family? You mentioned your own family.
Yes, unfortunately, I had someone in my family who I've lost dearly, a dear uncle. And I have someone right now currently in the hospital, a family member. So this continues, and the way to stop this is through the vaccination. Again, I cannot reinforce how important the vaccination is going to be when it becomes available and how safe it is. But for now, we must continue to take all the measures that we've been taking. We have to resist the temptations to gather. The holidays are very important, it's understood. But the COVID virus is very serious and can spread very quickly when we gather, when we don't social distance, when we don't wear a mask. So we have to hang in there. We have to be resilient. Today is a major, significant day of hope. And this is what's going to carry us through.
Doctor, what is your staff saying about the vaccine? How are they feeling today?
My staff is feeling equally hopeful. They also are ready to take the vaccination. As you know, we're going to start with the frontline workers. They will be the first. And then we're going to go to high-risk, vulnerable people. And so everyone's feeling great. Everyone was waiting for this day. This day could not have come soon enough.
Guys, 2 more questions, and then we're going to have to move it around.
Dr. Chester, do you want to say something?
I just want to say that, you know what, this is the beginning.
Yeah, you can come to the mic.
Sorry, my apologies. Thank you. I just wanted to say that this is the beginning of the end of COVID. Sorry. I just want to say this is the beginning of the end for COVID. Together, as a community, as a nation, again, please maintain wearing your mask, washing your hands, and your social distancing. Too many lives has been lost with this pandemic. Let's take advantage of this glimmer of hope, which is the vaccine, so we can move forward as a community. Once again, please, let's follow the rules, and we will get to everyone with the vaccine. It will take time, but we will get there. Thank you.
Dr. Chester, just if we can ask you, we think you may have given the first vaccine in the country live. You've probably given lots of vaccines. What was it like to give that first vaccine to Sandra?
While giving the vaccine as a clinician, you focus on your patient. So at that moment, my focus was on her, giving her the vaccine. After the fact, everyone telling me we are the first. So at that point, I don't think it has quite hit hitting. I'm proud to be here at Northwell and doing it on behalf of Northwell and our team members.
Thank you. Let me ask Dr. Mark Jarrett if he wants to have any concluding comments, and obviously if there's more questions, we can take them afterwards.
Thank you, Michael. So I just want to re-emphasize the concept of many centuries ago, people thought the world was flat and that scientists didn't know what they were saying. Clearly, we're at a different level. The science has been careful. The government agencies such as the FDA, the CDC, and independent advisory committees have looked at this issue and feel this is the right thing to do. And it's the right thing to do not only for ourselves, but honestly, it's also for our friends and families. By stopping the transmission of this virus, we will keep everybody safe. The real message is we are our brother and sisters keepers. We have to take care of everybody, not just ourselves. It is not only doing it because you want to protect yourself. And we feel that the science is there, this is safe, and we want everybody to accept so we can get out of the problems that we're having now with COVID, which not only are the death and the illness and everything else, but its effect on society in general. And we want to go back to having a normal society and a normal lifestyle. This is the only pathway that will work. Thank you.
Okay, thank you all very much. We'll take one or two more questions.
How many more employees will you vaccinate today, and how many doses do you have on hand to vaccinate here?
We will be vaccinating more today. Most of it will begin tomorrow, batches. So we get some doses today at some facilities. And then Wednesday, I believe we will get other batches, other groups of quantities of the vaccine on Wednesday for other hospitals. And in each week going forward, we will be getting more.
And then the second dose, when does that come?
The second dose is about 21 days from now. So Dr. Duroseau will get a card indicating that today he got the vaccine, and then about 21 days from now, he will be back to get the second dose. And we get a second delivery for the second dose.
And how do you ensure that no doses are wasted, since it really has to be handled with care?
We have, at Northwell, we have adequate capacity to store the vaccine in freezers. We can store millions of vaccines in the freezers that we have. We were prepared for this. It's all under the auspice of our pharmacy. And we're very, very careful and meticulous about when we take it out. There are a certain amount of time that it has to be used. And we got to make sure that we do not waste any of this vaccine. So we're very meticulously and very careful about how we handle it.
Once you take it out, how long do you have?
You have 6 hours. 6 hours. So what you see in front of you has to be utilized within 6 hours. Yes. Okay.
Exact numbers, because there's going to be rolling shipments, but do you have a target date when you can have the majority of your frontline, the most
Not specifically. It all depends on on how many doses of the vaccine we get each week going forward, because this is an increment. We have. I don't know the exact number. You know what the number is off the top of the head?
Sure. We have about 54,000 of our employees, hospital or other healthcare facilities that we have, like ambulatory sites, so that they're not exposed as much.
And it's those 54,000 you expect that vaccinated by January?
I would expect, hopefully, by the end of January. But again, as I said earlier, this is a marathon, not a sprint. We will get this to everybody, and as the vaccines come, we will use them. Getting back to the other question, to make sure we don't waste it as we do our priority list, if we say we're one site, we will book extra people as standbys in case somebody comes in and for some reason can't take it, they have a contraindication, they found out something, or they just got ill that day and couldn't take a vaccine. So we will have standby, because the one thing we don't want to do is waste a single dose.
Let's bring Sandra up for a few questions.
So, okay, here's Sandra again.
Hello.
Sandra, so, I mean, were you nervous? What were you thinking? You two have been on the front lines. What was it like, just personally getting the shot and sort of thinking about it now? I mean, it had to be an emotional experience for you.
It was an emotional experience. Working on the front lines alongside my team, I saw a lot of pain, hurt, suffering, death, and so I felt a huge sense of relief after I got the vaccine. I was not nervous. As I've mentioned before, I trust the science, so I had no hesitation when I was asked if I would take the vaccine. I've been waiting for this day for forever. So I'm happy it's here. I'm grateful that I had the opportunity to have access to the vaccine. And my hope is that in the coming months, more people around the world will have the same access, an opportunity.
How that's impacted you?
Fear, we come in every day courageous and ready to do what we have to do. After the first wave, we thought that there's no way we could go through this again. But I lead the ICUs here at LIJ, and we've been seeing some admissions, and we just roll up our sleeves because we know why we got into healthcare in the first place. And so we just roll up our sleeves, and we're willing to do whatever it takes to save lives.
Sandra, so you sometimes have to talk to these family members or the patients themselves when things don't go as planned, when things aren't going well. Is your message going to change now that there's a vaccine and that vaccine lives inside of you?
Yes, I can now share with patients and family, and hopefully, everybody's here, so everybody's seen this around the world, that I have taken the vaccine and that there is hope. So that's going to be my message, and to encourage people to just listen to the science. There are going to be a lot of talks, but to listen to the experts and what they have to say, and that I'm a living testament. I feel great, and when I have to do it over again in 21 days, I'll have no problems.
Why do you think you were picked?
As a healthcare worker, and no other reason except I'm a healthcare worker and working on the front line along with my team, and that's the only reason.
What's the last 10 months been like for you and what you've seen? Can you just talk a little bit about that?
It's been dark. That's one way to describe it. Dark, painful. Feel like this day would never come. So today I feel like there's light at the end of the tunnel. It's a long tunnel, as everybody has said, but I see the light. And so I'm very happy.
Sandra, what is it like for you personally, and what do you think it'll mean to your family and your colleagues? That you are first. You are making history in New York State, which is the first epicenter in this country.
So my colleagues and my family have already been reaching out to me and say that now that they've seen me take it, that they themselves will take it. I've lost family members myself. My cousins won't have their family members for Christmas this year. So it was incredibly important to me to take the vaccine and to be a part of the solution that will end this pandemic. I will say to my community that minorities have been reluctant to take the vaccine based on history. I would say to them that I don't feel that I was picked out or targeted. I don't feel like I've been used. I would say to them that this is different. It's being offered across the spectrum. We've been heavily affected, and so I encourage everyone that looks like me, everyone around the world, to take the vaccine. I am originally from Jamaica, and I'm sure they're seeing this as well. Sometimes West Indians in general, are reluctant to take the vaccine, and I want to encourage them to take the vaccine. That's the only way we're going to put a stop to it. It has to be global.
Sandra, today represents immense hope, much needed hope. How concerned are you about the holiday season and what you're seeing at the moment?
So I'm concerned that people are going to gather. As I mentioned, in my tradition, my family and I look forward to going home and celebrating with our friends and family abroad. And this year we are going to be celebrating virtually. We're taking that step so that in 2021, we'll be able to be together again in person. So I'd say to people, there is hope. Let's put off the celebrations. Let's do them virtually this year so that we can all be together next year in person. Thank you.
Thank you, everybody.
Thank you, guys. Thank you.
Folks, if we could ask you to break that as quickly as possible, we have more media coming in behind Jack.